This segment is sponsored by iChiro Clinics. In the medical field, it is always advancing, and that's why you want to make sure your health is in the best hands. That's why I'm here with Dr. Michael Kwast from iChiro Clinics. He's going to talk to me about the technology behind treating your neck and back pain. So what are we going to talk about today? What are you showing me?
Today we're going to show you the computerized adjustment.
Okay.
A lot of people are unaware of that. They didn't know that there are options for you out there. Some people don't like to be twisted and turned with the traditional chiropractic. However, we have options for people that don't like that with the computer, which we'll show you how that works.
Perfect. Let's get started.
Okay.
So Dr. Kwast, this is your computerized adjuster, and we've got the lovely Susan here who's sitting for us. What can you tell me about it?
All right, well, I'll show you how this actually works. So
perfect.
This device here is actually hooked to the computer, and we're going to actually scan down her neck and back.
Okay.
The computer is going to find where areas are not moving properly. So it's going to sense where the tightness in the deep muscles are.
Wow.
Once it finds that, it's going to tell me on the computer where those areas are, and then we will adjust those deep muscles with this device. The device will then stimulate the muscle until the muscle relaxes. It will sense when that happens and then shuts itself off. This way you don't need any twisting, turning, cracking, and popping, but you can still get the deep muscles to relax, decompress the joint, and get people feeling and functioning better.
Right, and you said that this is not necessarily a new technique. This has been around, but people just aren't utilizing it enough.
Yeah, people don't know about it. You know, one of the main reasons people don't go to the chiropractor is they're scared. They just don't have all the facts and all the information. There's nothing to be scared of with this technology. It's very easy, and you get great results with it.
All right, well, Susan, are you ready?
I'm ready.
All right, let's get started.
All right, so basically the first step is we're just gonna scan her, and again, this is going to show where all the tight spots are, regardless of what she's feeling. So even if you're not hurting, this thing is going to find where the tension areas are developing in your neck and your back, so we could actually act on them proactively. So it's telling me which segment here is not moving properly.
Okay.
So we're going to put the machine on that segment, and then the machine is going to gently stimulate all those muscles, and it's going to run until it senses the motion restoring in that vertebrae, and then it will shut this machine off.
Oh, it does it automatically then?
Yeah,
okay.
The computer is running it all.
Wow.
So it takes a lot of the guesswork out when you're just doing things by hand. The computer is doing it all and measuring everything, which then is going to allow us to go back and re-scan her, and we're going to be able to do a before and after comparison to show us the differences that we've made. And that way we can make sure we're getting as much change as possible on every visit.
Right, and so you said not only do you offer a computerized adjuster, but you also do adjustments by hand. You said one's not necessarily better than the other, but it just depends on the patient, their needs, etc.
Yeah, so everybody's just different, and so some people like certain things and some people don't. And really our whole goal is to get your function and get you feeling better. Any way we can. We don't really care the technique that we use. We just want results, right?
Exactly.
And that's what most patients want. So this just gives us options.
And perfect for the patient who's a little anxious about getting, put on the table and hands laid on them.
Yeah, exactly.
Right.
And so the computer's showing me we got about a 4% decrease in stiffness in her spine, just with that one treatment that we just did. Wonderful. And so that means she's going to be moving better, functioning better, and that helps prevent people from having injuries too, because if you're stiff and you go to bend to do something, your odds of getting hurt and pulling something are high. If you're not stiff and you bend to do something, the odds of pulling and getting hurt are much lower.
Right.
So this is very preventative too. You can take a person who feels great, we can scan them, we can find tension that they're not even aware of, nip it in the bud, and then they just don't ever have a problem from it. And who wouldn't want that? Right.
Who wouldn't want that? Absolutely. Yeah. Well, thank you so much for having me here and showing me this computerized adjuster. I'm wowed. And I can't believe that it's not a new thing. But thank you again. For more information on iChiro Clinics, you can head to our website online at wzzm13.com.